Okay, good afternoon, everybody. My name is Samantha and I'm based here in Sydney. Today we're going to be running a lunch and learn session on Gentoo settings and reports. We also have Tralia joining us. She'll be taking us for the reports section at the later part of this presentation. First of all, I'd like to start with acknowledging the traditional custodians of the land on which we stand, the Gadigal people. I pay my respects to elders and past, present and emerging. Let's have a quick look at the agenda about what we're going to cover today. So we're going to first of all look at Gentoo settings, notifications. We're going to look at setting a default site of service and also pinning sites of service. There's also a really important part that we're going to cover as well to do with health fund settings, which is going to underpin all of your health fund claiming. And then we're going to move on and look at some of the Gentoo reporting features. So we're going to look at accessing the reports, looking at the claims control window. We're also going to be looking at the reports dashboard, and Tralia is going to take us through the item report, referral report, and some missing invoices report. Let's start with Gentoo settings. First of all, I'd like to take a look at notifications in Gentoo. A lot of people don't realise that they don't have the notifications on. This is because when you first start using Gentoo, it's by default turned off. So it will need to be turned on. You'll know if you've got your notifications turned on because you'll see a bell in the top right-hand corner of your Gentoo window. If you don't see that bell, you won't be receiving notifications. Now, there's two things you can receive notifications on in Gentoo. That's when you receive a to-do or a task from somebody or yourself in Gentoo, and also when the doctor receives results in Gentoo. So if you want to turn on your notifications, what you'll need to do is go and click on the settings part of your Gentoo window, which is the cog on the left-hand side, and then click on the notification settings. In this window here, you'll see the notifications button at the top. You'll need to switch this on, and then there's two other settings that you may also want to flick on, and that's the notifications for the to-dos. And doctors in particular will probably want to receive notifications about when they receive results. And also there's an additional setting for results, which allows them just to choose to see notifications for abnormal results only. Once these are turned on, you will see the notification bell in the top right-hand corner of your Gentoo screen, and there'll be a little pink bubble showing you how many notifications that you've got. When you click on this pink bubble, it will show you your notifications, and you can look at your to-dos, and also the doctors will see their results listed in this notifications window. The next setting I would like to look at is your default site of service and also pinning sites of service. Now, this is a new feature that was brought in probably about 4 or 5 months ago. And what it does is it allows you to set the default site of service in your invoicing window to be the most common site of service that you bill from. So for most of you, it's going to be your consultant suites. The second setting that I'd like to demonstrate is how to pin your site of service. Pinning sites of service allows you to order the sites of service in this sites of service dropdown in the billing window. So let's have a look at how to do this. So it's per practitioner, and what you'll need to do is go to the settings part of your Gentoo window, and then you'll click on manage users and then open up one of your doctors. When you click on the sites of service section, you'll be able to click on the star to allocate the default site of service, and then you'll also be able to pin each site of service in subsequent order, which will allow you to order the sites of service on your billing window. And I've just got a small video here for you to have a look at to see how that works. So as you can see, we're now pinning the demo site of service, and it takes it to the top. And then we're going to also click the pin button to choose that we want to make ECLIPSE Consulting the second on the list. And the subsequent ones that you pin after that will then appear in the list in the order that you pin them. So that's another setting that you might want to change in Gentoo, just to make things easier when you're creating your invoices. Let's have a look at our health fund settings. So if you're doing any billing through ECLIPSE, you want to make sure that your health funds are set up correctly. Generally, when we set Gentoo up for you, we will do this, but it's important that if you get a new doctor starting, that you go in and set up these fund settings correctly. So we're going to be looking at the fee schedules. We'll be looking at the default billing type, the default gap, and also the Bupa ID. So these settings are found under Settings in Gentu again, and we're looking at the Health Funds section on the far right-hand side. When you click on the Health Funds, it's going to display all the health funds that you have available in Gentu. And then to modify the health fund, we actually click on the health fund. And these settings are doctor specific. So if you've got more than one practitioner in your practice, you'll need to do this for each of your doctors. So we're going to go and set up one of our doctors. And when we click on the doctor, we're going to see the practitioner details window appear. So these are the settings that we need to make sure that we have correctly set for each doctor. First, let's look at fee schedules. So generally, the fee schedules really only apply to a handful of the funds, particularly HCF, Bupa, and HBF, and generally HBF is only in WA. These funds are generally set to be either at the no-gap schedule or the known gap schedule. Now, whether the doctor is registered as a no-gap provider or a known gap provider needs to be set at the health fund end. So if you're not sure if your doctor is registered as a no-gap or a known gap provider, you need to call the fund and ask them. And then this will determine what schedule you set them at in Gen 2. If the doctor is a no-gap provider, it generally means that they can't charge a gap to their patient. The no-gap schedule is usually a little bit higher because they're not charging gaps to the patient. The known gap schedule means the doctor is charging gaps to the patient and is generally a little lower than the known gap schedule. So if you have a look in the Gen 2 window here, this little area here is where we choose the fee schedule. And like I said, it's only for Bupa, HCF and HBF. The next setting that I want to have a look at is the billing type. Okay, so the billing type is also set by the doctor, and it's how they normally bill their patients. So if your doctor normally bills known gaps, you can set the default billing type to no gap so that when you create the invoice, it picks up that the billing type is no gap instead of you having to change it each time. This can also be changed at the time of billing. If the doctor does choose to do a no gap, they can actually choose no gap at the time, but the default for this particular setting here is known gap. The maximum known gap can also be set per provider. For most funds, the maximum known gap is $500, but it does vary. If the doctor chooses that they only want to bill $300 as a maximum known gap, they can easily just change this to $300, and that will apply that gap each time. Bearing in mind, though, you cannot charge gaps for NIB, APIA, and also Qantas Health Funds. And look, if you're not sure what gap to charge, ring the fund because they do vary. And it's something that they will be able to tell you as opposed to ringing out Jimmy's support desk. Okay, and the last thing that I want to go through is the claim type. So this is the claim type showing on the screen. Usually you would set this to be known gap, a scheme for a known gap claim, and also agreement for a no gap claim. So generally, this would be set up at the time of you having ECLIPSE. There are some exceptions to the rule, though. So with Medibank and AHM, it must always be set to scheme. If a claim gets sent as agreement, it will be rejected and you'll have to change the claim type and resend it as scheme. And it's always agreement for a Bupa fund. And the last setting that I want to show you is what we call the Bupa ID. It's also known as the payee ID and sometimes also called the practice ID. And it's only used by Bupa funds. And it's the number that tells Bupa which bank account to deposit the doctor's payments into. So every doctor needs to have a Bupa ID entered into their Bupa preferences in the Gen 2 system. If they don't have the payee ID in there, Bupa may agree to pay the money, but they won't know where to put the money, so you won't actually receive the funds until they get your Bupa ID. So just bear in mind that there's 7 Bupa funds that this needs to be entered into. They're listed on screen. So ANZ, Bupa, of course, HBA, Health Cover Direct, MBF, MBF Alliances, and also Mutual Community. So all these settings here underpin your successful health fund billing. We also need to make sure that we've got our hospitals added into Gentu, as well as the facility IDs or the hospital provider numbers. So these can be added via the address book in Gentu. If you click on the Add button in the right-hand corner and choose Hospital, this will allow you to add the hospital. It will also allow you to mark that that procedures will be performed at the hospital, and you'll also be able to add in the facility ID, which is the provider number of the hospital. Now, if you're not sure what the facility ID is, you can go straight to Google and type in hospital facility IDs, and that will take you to a Medicare webpage that will list all the facility IDs for every hospital, and you can just copy and paste it from there. Okay, let's look at the Gentu claims control window now, because this is all underpinned by the settings that we just covered in your health fund area. So the claims control window is accessible by the reporting section in Gentu. Now, if you're looking at your Gentu screen and you cannot see the reporting section, which is the one that's just highlighted on the screen there, it means that you probably don't have access to the reports in Gentu, and that you'll need to contact your Gentu administrator to give you access if you need to access this part of Gentu. So the claims control window is where all electronic claiming is presented in Gentu. So that includes patient claims, Medicare batches, DVA batches, and also health fund claims. All of your DVA and Medicare claims are sent automatically at 10 p.m. And once the remittances have been received for all of your electronic claiming, including your health fund claiming, it's automatically received in Gentu. So you can access this window by going to Reports and then clicking on Claims Control. This is the window that gets presented when you click on Claims Control. In the top left-hand corner, you'll see that you've got 7 invoices waiting to be sent at 10 p.m. tonight. So these are going to be your Medicare batches and your DVA claims. You can also filter your claims control window by the provider by clicking on the drop-down on the left-hand side, and also by date, by clicking on the from and to dates. In the top right-hand corner, we have some tick boxes. This will filter the view that you're seeing in your claims control window. It will show you exceptions, anything in progress, and anything that's listed under finalised will be anything that's been automatically receipted. You can also see with the blue circles that we've got a variety of claims there, starting with a patient claim. We've also got a claim to the fund and a couple of bulk bill claims. I'm going to quickly step you through a couple of exceptions in Gentu, because I know that this area here is sometimes what confuses people in the reports section in Gentu. So there's 2 main types of exceptions that you're going to receive in Gentu. One is where the claim may be underpaid. So that's where a different amount's being claimed to what's being paid. And it's maybe, or generally because the wrong fee schedule is being linked to a doctor. So like I said before, in our health fund setup, we need to make sure that we've got the correct fee schedule selected, because it's actually at the health fund end that this is determined, and we need to replicate that in Gentu. So if you've got the wrong fee schedule selected, you're likely to get errors where they've paid you less than what you've claimed, and this will come through as an exception in Gentu. So what we need to do is we need to adjust out the amount that they haven't paid, and then we need to mark the claim as resolved. So in the claims window, you're going to be seeing the icon on the top right-hand corner, which is the Adjust button. When you click on that button there, it will bring up the Adjust window, and it will automatically adjust the amount out that is the difference between what's being claimed and what's being paid. You just need to apply that by clicking the Apply button. And once that's been applied, you can tick the Resolved button at the bottom and then select Save, and that will resolve the exception. The next common type of exception is a fully rejected claim. Now, generally, this is because it could be a duplicate. Somebody sent it twice, and they're definitely not going to pay it twice. Or it could be the level of cover of the patient. They might be covered for that particular service. Or it could be the provider registration. All of these will cause a fully rejected claim. So there's a couple of things that you can do here. You will adjust the entire amount out and mark it as resolved. So this is in the case of a duplicate claim where they're definitely not going to pay it. So we just generally adjust the entire amount and mark it as resolved. Or if in the second scenario where the provider is not registered, what you could do is make sure the provider is registered. So contact the fund and register them. And then all you need to do is tick the box that says reclaim item and then hit the button that says reclaim and it will send it through and it will likely be paid since now the provider is registered. So there are a couple of exceptions that you're going to come across in Gentu, and hopefully that will help you resolve them going forward. There are a couple of tools in Gentu that will help you to manage your exceptions in the claims control window. We've got a reviewed eye icon. So once you've looked at a claim, you can actually tick the little eye icon on the right. It will turn it green, and that will help you organise your claims control window so that you can see which ones you've looked at and possibly which ones you haven't. There is also the ability to add a comment to a claim as well. So you might want to add a comment once you've contacted the fund, or you might want to put in a comment to say that you've contacted the patient to get further information, such as their fund number to cross-check the details. So by clicking on the claim and selecting the little plus at the very bottom of the claim, this will open up the comments section of the claim, and it will allow you to put in some notes about your actions and save the note in the bottom right-hand corner. So this just helps you follow up where you're at with the claim. There is also the ability to view payment references in your Medicare claims control window. If you click on the date once the claim's been paid, this will also show you the payment report. So this is quite handy to see how much money has gone in with the claim, when it was paid, and which claims were paid in that deposit. So this is also a handy reference to have a look at once your claims have been paid.
Hi, my name is Tralia. I'm one of the trainers from the Sydney team, and today I'm going to take you through some of the reports available in Gentu. So in Gentu, the way you can access your reports is through the graph icon in the left navigation bar. If you can't see this icon, it's likely that your login does not have the appropriate permissions enabled. Your administrator will be able to give you access to these reports by changing your role in settings under Managed Users. For our session today, I will be going through the dashboard, the referral report, the item report, and the missing invoices report. The report dashboard shows you an overview of your practice's metrics for the selected date range in the categories total amount invoiced, new patients, new referrers, appointments, and procedures. At the top of the dashboard, you will find the date and provider filters, which are applied to the metrics in pink for each category. You can set the date range by selecting a time period from the drop-down menu, and you can include multiple providers in this report. You can also click on each of the categories on the dashboard to view a graphical representation of that data. The first category is the total amount invoiced. The value shown in pink shows you the income generated by your practice in the selected date range. Hovering over a month in the graph will display the total amount invoiced, and you can right-click on the graph to display the same information as a table. As the name implies, the total invoice category only shows you the figures for the money invoiced, not receipted. Similarly, in the new patients category, the value in pink shows you the number of new patients that have started to visit your practice in the selected date range. Hovering over one of the circles on the map will display the number of patients from that particular suburb. You can also right-click on this map and select to show as a table to display these patients in a table form. The new referrers category shows you doctors who have started to refer patients to your practice in the date range selected. The graph displays the income generated from each provider as a result of those referrals. Hovering over a referrer will show you the income generated by that referrer, and clicking on them will highlight their metrics in pink. You can also right-click on this graph to view this information as a table. The appointments category will show you the number of appointments booked within the selected date range. Hovering over this graph will display the number of appointments booked by appointment status. Any appointments, such as the meeting, without a status will appear as unspecified. The procedures category shows you the number of procedures completed within the given date range. A procedure is considered complete if the booking appears in the appointment book and it has a date in the past. Pending procedures are not included in this metric. And hovering over the graph will break down the procedures into different categories as indicated by the legend on the right-hand side. You can set procedure categories within a patient's procedure record. This is located underneath the procedure name. A category can be chosen from the list, or it can be created at the time of allocating a procedure category. So you can just type in the name, save, and save that record to create a new category and allocate a procedure category to that procedure. Another way of creating a procedure category is through through settings, heading over to quick lists and clicking on procedure categories. To remove or edit a category, simply highlight the name, edit the name, or click on delete to remove. Next, we have the item report. The item report shows you the item numbers billed in your practice and the income generated from those items. The report is based on the service date, and the dollar figures are based on the amount invoiced. You can narrow down the results displayed using the filters on the left. Simply select your providers, service locations, items, and date range. The graph on the right will display the selected billing items and break it down further into the different account types. Hovering over this will display the total amount invoiced per item number per account holder, per account type. And the table below breaks it down further by consulting or operating location. Clicking on the legend on the right-hand side will highlight all of the billings and item numbers under that account type. You can also click on the table headings to sort the information in ascending or descending order. To export a copy of this report, use the CSV export button in the top right corner to save it to your computer. You can also print the report you are viewing using the print button, or if you would only like to print the table, you can click on the focus icon on the top right of that table and click print to just print what you're viewing. The referral report gives you an overview of your practice's referral information. You can narrow down the results displayed using the filters on the left-hand side. The provider, site, and referrer drop-down menus are contextual, so they will populate with results accordingly based on the doctor, the location, and date range that you have selected. The graph on the right-hand side will show you the income generated from the patients that have been referred to your practice during that time period. Hovering over this graph, on the graph, you can also view the number of referrals and location of referrals. Hovering over this graph will display the total income generated by that referrer based on the amount invoiced. The table below displays the referrer's details as entered into your address book, and clicking on the referrer's name will further refine the results displayed in the report. The provider's columns in the graph will be highlighted, The number of referrals in the graph will isolate for that selected doctor only, and the list of patients at the bottom will only show display of those referred by that particular doctor. Next, we have the missing invoices report. The missing invoices report allows you to find a list of unbilled patient appointments and procedures within a certain date range. Gentu does this by looking at the patient's appointment date and then comparing their account history to see if there is an invoice with a service date matching the date of their appointment. The goal of this report is to not have any patients displaying on this list. You can use the filters at the top of the screen to narrow down your search. You can manually put in a date range or click on the 3 dots to select one from the list. Clicking on the patient's name will open their file, and clicking on the date will take you to the appointment book on that date. This will also display their appointment or procedure. If a patient in the report does not require an invoice, you can remove them from the report by ticking the checkbox in the Not Required column. Once ticked, that patient will be hidden from the list of unbilled events. However, you can still display them by selecting the Show All checkbox at the top. So that concludes our session for today. We would like to thank you for taking the time to join our Lunch and Learn on settings and reports in Gentu. For more information on what we have covered, you can head to our online knowledge base where you can search for a topic of interest. We also have some categories that you can browse with articles. Through our website, you can also contact us by submitting a request with your GTU number, and one of our support team will get back to you as soon as they can, or you can speak to someone from our support team using our live chat, which is also through our website. For help with Medicare registrations, you can call the Medicare e-business line on 1-800-700-199. And for assistance with ECLIPSE claims or to check the doctor's registration, ECLIPSE registration with the funds, you can head to servicesaustralia.gov.au and search ECLIPSE functionality or call the individual health funds for further clarification. If after our session today, you are interested in getting ECLIPSE, you're welcome to give our lovely sales team a call on our main number, 1300-889-362. Okay, so now we will conclude our session today by answering a couple of questions that have come through during the session.
One of them is about your fee schedule and Bupa. So just from Lena, so just to let you know that, yes, that would probably be to do with your fee schedule with Bupa. What you would probably need to do is call Bupa themselves and find out if your doctor is registered as a no-gap or a known gap provider. It's the fund who sets that. So once you find out if they're registered as no gap or known gap, make sure that that's how you want to be registered. And then you can change those settings in Gentu. If they're registered as a known gap, you can fill in a form to re-register them as no gap. But you have to get registered at the funds end first and then replicate that setting in Gentu. Okay, Nav, got your question here. So the maximum known gap for each fund, no, it's not automatically set. You'll need to go and set that for each fund. So you'll need to go into settings in Gentu under health funds, and you'll need to open up each fund for yourself and set it. When you do your first known gap billing for a fund, it will ask you if you want to set that as the default amount for the fund, and you can select yes, or you can preset it up in your settings area under the health fund section. Let's have a look at what else we've got. Okay, how do you apply a deposit to a committed invoice? So I'm guessing that's a known gap that you want to apply. You should just be able to hit the pay button. When you hit pay, you should just be able to select the deposit from the drop-down payment type that's already been entered into the patient's account. And that will transfer it from the deposit and apply it to that specific invoice. What else have we got here? Okay, somebody's just let us know that NIB have recently changed their rules around no gap. So thank you for letting us know that. We might want to contact NIB, anybody who has NIB patients out there, to just cross-check that. It sounds like they might have changed their rules recently. So let's contact NIB about that one. Okay, somebody has asked, how can we set up the billing as the concession rate? So at the moment, you can really only set up the default billing type as either bulk bill, DVA, or private. We have got a lot of requests to make that change in Gentu. So it may be something that we implement coming forward so that we can allocate a default billing rate per patient. But at the moment, you just need to select that at the time of billing. Okay, another question about your health fund being under scheme or agreement. Generally, with health funds, if you're a known gap provider and you're billing known gaps, it should be set up as scheme. Scheme is the fund word for known gap. So it should be scheme, and agreement if you're no gap. But like I said, AHM and Medibank should always be scheme. Okay, we've got somebody asking, can I print or export all unresolved invoices to CSV? Yes, you can. So if you go to the unresolved invoices report window, there is an export feature that you can export that out. And then we've got something from Neil Kumar. Can the hospital be then set as default? Yes, you can. So that would be in your site of services under your user preferences, Neil. If you set that as default, every time you create an invoice, that will be the first or the default site of service that appears on the invoice window. So if you're doing only inpatient billing, that might be what you want to do. Okay, Ananta, can we make a claim as no gap even though if we've volunteered as a known gap with Bupa? Yes, you certainly can, but you can only bill at the known gap rate. So you'll have to still bill with a known gap fee schedule, but you can certainly bill a no gap. Okay, and just having a look through to see what else we've got here. And somebody has, this will be the last one, somebody's asking if it's possible for work cover forms to be pre-populated via Gentu. At the moment, no, it's not. It may be something that we do in the future. The only thing you can really do with work cover at the moment is you can add the claim details in the patient details window under claim. So that way, if you go to bill the patient or bill the work cover company, when you go to bill, you'll choose other as the account type and then select the claim, and that will automatically drop in the claim details to the invoice ready for posting to the work cover company. And I think that's all we have time for today. So thank you very much for your time. Please feel free to send through any other questions to our support desk and they'll get back to you with any responses that they have. But thank you very much for your time and enjoy the rest of your day.